Good evening, everyone, and welcome. Thank you all for joining us. My name is Keisha Golden Cooper, and I'm the Director of Guidance for Teaneck Public Schools. Welcome to another parent webinar series with our wonderful clinicians with the Mental Health Initiative. On behalf of my superintendent, Dr. Irving, and the entire Board of Education, thank you for joining us this evening. Whether you are joining us live or watching it a little bit later, the information that you're going to receive is invaluable, and we are excited to be able to present this for you. So as you can see, we're going to be talking a little bit tonight about managing COVID fatigue within the family. I'm going to turn it over to the experts in the field. They will introduce themselves to you, and I will be back to do a little question and answer and wrap up later. So thank you and enjoy.
Thank you so much, Ms. Cooper. We really appreciate, again, having this wonderful opportunity to be able to present to the families and parents of Teaneck Public Schools. My name is Jose Luis Bozos. I am a licensed professional counselor. I am also the acting clinical operations manager for the New Jersey Pediatric Psychiatry Collaborative, which is a grant-funded program through the Department of Children and Families in the state of New Jersey, and the awardee is Hackensack Meridian Health. And I'll pass it along to my wonderful colleague, Jairi.
Good evening, everyone. I am Jairi Davis-Jones. I'm also a licensed professional counselor. I have had the pleasure of working with all of the students and parents of Teaneck. I have a private practice in Paramus where I service families and individuals. So again, I'm just excited to share this information with you all tonight, and let's get started. Thank you, Jose.
Awesome. So one of the things that Jairi and I really felt was salient more than ever has been kind of understanding the impact that COVID-19 has had, not just on an individual level, but as a community. And by community, we're really defining that as within the family. Many of you have been, sheltering in place for a little over a year now. And we have to understand that there have been significant impacts that COVID-19 has had, not just on individuals' health, but on other factors. So again, we know that this coronavirus emerged out of China and was later reported to have spread throughout the world that created this pandemic. We know as of right now what this pandemic has done really has affected parents and children's, abilities to cope. So we know for a lot of parents and children that we're seeing, for individual counselings, has been, this experiencing these negative moods on a nearly everyday basis. We also know that many families had experience with job losses, unfortunately, due to the pandemic, and depending on the sector that you were working in, which inevitably has led to household income declining, and also just creating an additional burden on providing more care to either loved ones within the family or our children. For many parents, we know that not only were you playing the role of being a parent, but you were also playing the role of being a chef, of being a teacher at times, So these added responsibilities have definitely created not just a fatigue in some families, but also have created a burnout, unfortunately. And more so, we've seen kind of how COVID and being sheltered in place has led to some of these symptoms that were already there to begin with being exacerbated. And then just the multiple losses that families have experienced, not just through death of a loved one, but just some of the milestones that some individuals experience, birthdays, proms, family outings, vacations, graduations. Like, these were all significant milestones that many of us already anticipated experiencing and were told that we couldn't. Jairi?
Yes. So what is COVID fatigue? That has been the new question question of the day, right? What is that? I know I'm tired. I don't have a title for it, but that's exactly what it is. It's COVID fatigue, right? It's burnout. And it implies that a person has reached his or her capacity to cope and is experiencing various mental, emotional, and physical symptoms as a result of the constant exposure to the pandemic stressor. We've been asked to social distance, the isolation from family and friends, the fears of contracting COVID, numerous virtual meetings as opposed to the person to person that we were used to, the grief of losing loved ones, and definitely financial burdens and stress. So those are all some examples of ways in which we have become fatigued from COVID.
Yeah, and I know, Jairi, maybe for you and I, we would definitely would love to be able to do this type of presentation in person.
Oh, yes.
Because quite frankly, it is really tiresome to be online for most of your days, and our brains weren't built that way to begin with.
Right.
So we have this added stressor of being on and being on Zoom calls. And sometimes I'm just like, if you can send this in an email, I'd rather prefer that having to get on one more Zoom meeting.
Right. We're definitely missing that person to person interaction,
Yeah, agreed.
All right. So the next slide is about how COVID fatigue has affected our families, right? The parents' perspective. So some symptoms that the parents may be experiencing, and when I say parents, I do include myself, as I have 3 children. So we're experiencing exhaustion, right? Physical and mental fatigue, a lack of energy. Like we're being forced to now bring our work environment into our home. And so where do we find the energy to continue to separate our children from our workspace, right? And vice versa, workspace from family time, feeling constantly overwhelmed, sad, or helpless. The inability to complete daily tasks. Again, when everything is intertwined, how do we set those healthy boundaries so that we can complete tasks, both family tasks, such as laundry and household duties, and your normal work load. Increased irritability, reduced work performance, and isolating from others, even within the household, right? Sometimes we are just trying to find a space just to release and kind of process everything that's going on, and to be able to do that without all the questioning of our children, right? Where is that space? It used to be maybe you drive home from work. It used to be maybe, in the office, someplace by yourself, isolated. And now everything has been moved to the home. So it's pretty stressful.
Mm-hmm. And one of the things that, Jairi will definitely hit on more is kind of reestablishing these boundaries. Because as Jairi kind of mentioned, we have definitely lost a lot of boundaries now working remotely. There isn't that line of separation between work and home life. It's all merged into one. And I know for Jairi and I, we often joke about how, we're working, remotely, and you would think it's easier, but it's definitely been a lot harder. And sometimes there are days I'm just like, I don't know if I can keep going through this. And it's really relying on our friends and our families to kind of give us a little bit more support. And
Yes.
And the other piece of this is that, and more along the line tonight, is figuring out how to give ourselves that space to reconnect, re-engage, and re-energize, because we all definitely need it.
Yes.
So from children and from the children and teenager perspective, we definitely know that children and teens are burning out related to the coronavirus precautions, and by that we're talking about the social distancing, the masks, the not be able to hang out with friends, and also at the same time it's been really frustrating for some of the teenagers that I've worked with who have expressed as like, I can't understand why I can't do this, but my best friend's family can. So I'll give you kind of a perfect example. Like, I was working with someone last week, and it was like, my friend's family are going on vacation, and I'm just so jealous that I can't go because I got invited, but my parents said no. And that's exhausting for parents, having to kind of explain why that doesn't work in their household. So these kind of things, these conflicts that are arising, not because it's being created within the family, but because what's going on the outside that we have no control over things, you know, which again creates this feelings of frustration, anger, depression, resentful, because they're feeling like they're having to give something up. And one of the other pieces that is also important to note is for children and teens at this stage, from ages 5 to all the way up to the age of 18, their sense of justice and fairness is being challenged because that's the number one thing that they care about. And you hear this as parents, like, well, that's not
That's
fair.
not fair.
No, that's not right. Yeah. But that's because at this age, that's really what matters to them. So oftentimes when you hear that, it's not because they're being difficult, it's because it's developmentally appropriate. They're at that stage. You're supposed to be discovering what is right, what is the sense of justice about things. And here, it's all being turned upside down. And then the other piece of it is that even as for parents and for teens, they're receiving so much information, not just about the pandemic, but regarding their schools, regarding changes in protocols. Like everything is never stagnant. It's always changing to one thing or another. And it's hard for them to keep up. Even for me as an adult, as a 35-year-old man, I'd like to believe I have all my things in together, but I also know how difficult it is to have to change when I already had something established, when I had a routine. Um, and then other things that we're noticing is that they're feeling disconnected and from their families sometimes, and even from their friends.
Friends, yeah.
And they're actively or sometimes delaying avoiding certain responsibilities. And the reason for that is mainly because kids need to have a sense of control, and they will exercise their control whenever possible. So if they don't feel like they have control about what's going on, they will find control in other things, such as deciding when they'll go to bed, such as deciding when they'll eat, such as deciding when they'll brush their teeth, because that is their way of feeling like they have control over a situation that otherwise that doesn't allow them to have. Jerry, I feel like you had something to say.
Oh, no, you said it. I did. You said it. Thank you.
Yeah. And then lastly, the other thing is that there have been physical symptoms as well, where a lot of children and teens have reported experiencing headaches, stomach aches, not being able to fall asleep. And this is all due to the fact that being sheltered in place has broken a routine that they've become accustomed to. So one of the things that I will always tell parents and children and teens that I work with is, if there's anything that you can remember out of my work with you, the three things that you will always need in life is structure, control, and safety. If those three things are always there, things will always get better. But what has happened with COVID-19 is those three things were removed and were attacked. So the sense of safety that they once felt wasn't there. Their sense of control that they had about what dress they were going to wear to the prom, was taken away from them. And the structure of like bedtimes, meals, going to school, going to sports, all those things were gone. So of course they were going to react in ways that we were not prepared for at this time.
And Jose, just to add to that and going back to the parents' perspective, it was pretty similar to that, right? Parents had to, I remember going into the grocery store, you could no longer say, I would prefer Bounty over Viva paper towels. There was fight or flight. There was, you get what you can get. And so it put us in this mindset of survival, right? We didn't feel those three things, the structure of just picking the day that you go to the grocery store. That got turned upside down because now you need to go when there's things available, right? Also the control. You didn't have control over which brand that you wanted, what product you wanted. It was just, you need to get this. And then also the safety. There was no safety, right? I have to get to the store first. My family needs these things, and how we survive if we don't have them. So if you already have pre-existing anxiety or depression prior to COVID, then everything had just heightened, right?
Mm-hmm. Yeah, and ironically enough, Jairi, one of the things that we saw early on in the pandemic when we were sheltering in place is The one product that was actually being sold out the most,
Mm,
aside from paper towels and toilet papers, because that's the
those
one
were
thing that
top.
gives a lot of people security, is actually yeast. And the reason for that was because a lot of families ended up taking baking as a hobby during the
Mm,
pandemic. And
yes.
if you've ever baked in your life, one of the things that baking provides you is both structure and control. Because if you're baking, you have to follow that recipe.
Recipe.
You
Yep.
cannot deviate from that recipe. If not, you're either the bread doesn't rise, something ends up being off. So there was a lot of baking going on because families wanted to feel that control and that structure again. And baking is how that got provided through baking bread.
Mm, nice.
Jerry, do you kind of want to preface this video?
Absolutely. Absolutely. So Jose and I wanted to share this video with you. I kind of just want to preface it a little bit without giving it away. Similarly to what I just shared about how, parents are finding it difficult to find this space to release without guilt or unapologetically to the students or to the children. Because again, when we were, prior to COVID, we created a space where we could hide all of our emotions, all of our fears. We thought that was the healthiest thing to do, and we didn't want our children to worry. And now, our children are seeing us and they're asking questions. And of course, Jose and I would say that's a healthy thing. But, to many parents, it's like, I don't want my child to see me stressing. I don't want my child to see me struggling. So how can I hide that? And that is a constant burden that us parents carry around with us on a daily basis. So I just want to preface the video by saying that I really want you to watch it, and we'll discuss a little more after.
Okay. Daddy is the sweetest daddy in the world. Daddy is the most handsome, the smartest, the most clever, the kindest. He is my Superman. Daddy wants me to do well at school. Daddy is just great, but he lies. He lies about having a job. He lies about having money. He lies that he is not tired. He lies that he is not hungry. He lies that we have everything. He lies about his happiness. He lies because of me.
Wow, there hasn't been a time that I've watched this video and I haven't teared up. As a parent, again, we want to be that superhero, right? We want to hide all of our insecurities, all of our fears, all of our worries from our children, and COVID just hasn't allowed the space to do that. But the goal of Jose and I's presentation tonight is to yes, acknowledge that we are all under this stressful environment, but we can definitely find a space within this environment to still care for ourselves so that we do not experience fatigue, and we can find a space to turn those conversations into something healthy and speak to your children about what they are experiencing due to COVID, because most likely you guys are experiencing similar doubts and concerns and worries. So it'd be a great thing to share amongst the family.
Thanks, Jairi. As Jairi was kind of alluding to our conversation, really the point here for us is ensuring that we can't avoid the fatigue that we're going to be experiencing, because it's inevitable given the current situation that we're all experiencing in at this moment. But it's a matter of how can we manage it when it does happen? What is it that we need to do to ensure that when we are already feeling tired, fatigued, or burnt out, that we're taking those steps to be able to either re-energize ourselves, recommit ourselves to our boundaries, reestablish our boundaries. All these things are really important to be able to reduce COVID fatigue throughout. Again, there is a light at the end of the tunnel, which is one of the things that I have been very grateful for, because we are now seeing the vaccines, and we are seeing kind of the effectiveness of vaccines as they're being rolled out in the United States. Right now there are 3 vaccines that folks who are eligible to receive are able to get them, and we know that they've been really, really effective at preventing complications or hospitalizations for folks. So for me, the reason I speak about this is because I need to acknowledge one of my coping skills is having a sense of hope and being able to see what is it that's out there that I can really focus on. And of course, there are many other coping strategies that we're going to be talking about in tonight's webinar.
And I like to focus on the parent strategies, right? What are some ways that we as parents can cope during this pandemic? So we can get some sleep, try to find routines, right? So put yourself on the schedule, okay, and set a goal. I'm going to be asleep by, 9:00 tonight. I realized that, yesterday I was tired. I went to sleep at midnight. So I'm going to try and go to sleep a little bit earlier so that you can fully function for the following day. Spend time with your children, put everything else aside, cell phones, any distractions, and spend some quality time with the children. Ask them, how's your day going? Do you have any concerns, any worries? Communicate openly and honestly, which is what I was referring to earlier when I was discussing the video, is try to have those conversations by saying, I'm a little worried and sometimes I'm stressed out. Are you as well? So that you are opening that channel for communication, healthy communication for you and your children. Have a sense of humor. Sometimes the saying is like, when you can't do nothing else, at least laugh about it, right? Just laugh about it. And sometimes I remember my grandmother used to say, you laugh to keep from crying, right? Let's get through this, as Jose was saying, and look forward to the light at the end of the tunnel. Encourage relationship building. And this has been a constant struggle when working with the students, because right now, all of our communication has been virtual, right? Zooms and Meets. And so when we say encourage relationship building, you think right away, okay, well, you can talk to your friends. Well, how am I talking to my friends? Zooms and more Meets, like I do that all day in school. And so you just have to find creative ways. Maybe you go back to the days of writing to each other, right? And actually mailing things like snail mail. And then remember to be kind to yourself. There is so many negative things happening already in the world and so many people saying negative things, that the one thing that you can do to encourage yourself is be your own cheerleader, right? When things aren't going well, say it's okay. You know, I'm going to do better tomorrow. I'm going to set goals tonight so that I don't experience this anymore. I'm going to intentionally survive the pandemic and discover, you know, a talent or a skill that I have, or that something that my family we can invest in. So definitely remember to be kind to yourself.
Mhm. And I would also kind of say this other piece, which is aside from coping as parents, it's also important if you are in a relationship with a significant other, whether that be a spouse, boyfriend, girlfriend, partner, whoever that is, that you are all checking with each other as well.
Yes.
I understand and understand the value of prioritizing your kids. But aside from this type of work, I'm also a couples therapist. I oftentimes have to remind couples that your priority needs to be to your relationship, to your partner first. Because if you and your partner are well, have a strong foundation, your children will be okay. You know, and I think that's a hard piece for a lot of parents to swallow sometimes, where it's like, no, I have to be there for my kids 100% of the time, all the time, and that's not true. Because that's not realistic. And one of the things that is really important to kind of role model for our children is, what does a healthy relationship look like within a committed romantic relationship? And that means being able to spend time apart, you know, being able to say, hey, you know, mom's not doing okay, so I'm going to take the responsibilities of cooking tonight or cleaning, you know, and being able to see those type of things. So those are other ways for parents to be coping as well. It's not just uh, coping with these skills, which are just really important too, but also coping as a partnership. You know, whether that is spending time together, or whether at the same time spending time away from our children sometimes, because that's also important. You know, we can't just fall into the one identity of being parents all the time, because we have other things, other identities that we're connected to. And one of the things that we know that is really important as we combat COVID fatigue is building resiliency with ourselves. And the best ways that we kind of do this is through self-compassion. You know? And that's really difficult for some of us to be able to do that, to be able to, as Jairi was kind of mentioning earlier on, is teaching, being okay with saying, you know what, I'm not okay right now. And this is the best that I could do given where I am, given my resources. Because our best will always change. You know, my best today might look very different tomorrow if I didn't get a good night's sleep, or got into an argument with my significant other. All these things impact us, but I can always say I did my best given those circumstances. You know? And one of the things that we also know that is really important when we're having difficulties being able to be compassionate with ourselves is actually putting ourselves in a position where, if we were to say, you know, if someone and that we knew was going through a similar situation that I was and came to me for support, what would I say to them? And oftentimes what we find is that we're able to be kinder to others and not to ourselves so immediately. But if we did that, if we just took that moment to say, like, you know, if if I was not feeling well, or I was struggling with something, but Jairi was the one who told me that she wasn't doing okay and struggling, what would I have said to her? And my answer would have been that of support, kindness. And that's the same messaging that I can give myself when things aren't going well within my own household, within my own role as a parent, as a husband, so on and so forth.
And I like to add to that, Jose, even a step further is treating yourself too, right? There are certain things that we do that makes us feel good. Or sometimes we think it's going to make our friend feel good. So if we know our friends had a rough week, maybe we might, send them flowers, or we might take them out. And of course, pandemic life, we can order in, order from your favorite restaurant, right? Bring it to you. Take that long bubble bath, right? To say to yourself, you know what, I have had a rough week, and rightfully so, because this happened and that happened. And, one thing led to the next, and I'm just really beaten up right now. So what can I do to help myself to get to this place of greatness or acceptance? And so think about, again, as Jose was saying, everything that you would do or say to one of your best friends, right? Maybe a sibling, and internalize that. Say it to yourself, be your own cheerleader.
Mhm. And the other piece, just to that I, as you were talking, Jairi, that I also thought about is that there are sometimes where I, as a person, when I'm struggling, when I know that I had a bad day and I didn't do my best,
Mhm.
where I just have to kind of admit that, today wasn't a great day, and I think that's hard to hear sometimes, but we have
Mhm.
to own that, But
Yes,
again, thinking about what that does for our children is it models for them that it's okay for us to make mistakes and that we're able to bounce back from them.
absolutely.
Mhm. Jairi, all you.
Absolutely. So some coping strategies for children and teens. So children thrive. I think Jose actually hit this earlier, right? Off structure. They were used to going to school at a certain time, waking up at a certain time. There was structured time for playing, right? They were used to going to a certain building and riding on a bus and socializing with friends. So right now, it is important to consider putting some of these things back into their schedules, right? And as some schools are opening back up and then closing back up, I think that the children are becoming even more resilient, right, to this change. And so, how can you put some of these things in place at home to prepare them for going back to school, or just at home to prepare for a healthier lifestyle? Because we've been very relaxed since COVID. Like children are going to sleep later, waking up whenever. So structuring time. And a place for schoolwork, maybe having a desk in a certain place in the home so that they understand this is where I go to do schoolwork, here's where I'm focused, and kind of putting those boundaries into place. And now when I'm leaving out of my room away from my desk, then it's like home and I can kind of relax. Doing some physical activity. Maybe you all can take a walk around the neighborhood, maybe just a walk around the parking lot. But you can definitely get some physical in, even doing some YouTube videos. I myself, along with my children, started exercising with YouTube videos, nutritious meals, planning that together with the children. Let's do something healthy tonight. Have them be creative and come up with the meal so that they are invested and that you have that buy-in. So there's not much pullback, right? Free time for leisure activities, and put that into the schedule. All right, these are the hours that you are free to do, X, Y, Z. And so please utilize those hours, because here's the schedule. You can't put it in place else.
And I think the other piece of it here, as a family as a whole, kind of with what Jairi was mentioning, is there are other things that can be done, within the family unit, which is taking things day by day or moment by moment. Sometimes it's, we have a tendency as humans to kind of anticipate or try to look into the future about situations, but in this moment in time that we're living, we can't. So it's really kind of saying to ourselves, I can't look too far down the road, you know and that's okay, and realizing that, again, we will all have those good days, bad days, or great moments. And it's okay that if those days, if we have something that didn't go great that day, that doesn't mean that our entire day is ruined. It just means for that moment, for that time, for that 1 hour, that was uncomfortable, that was not okay, and looking at it from that perspective rather than generalizing it and saying, this ruined my entire day. Again, modeling that compassion for ourselves, for one another, for our kids. I oftentimes think that being able to help our kids get through this, which is helping them understand like it's okay that today didn't go great, for them, that something didn't go the way that they had planned, because no one really prepared us for this type of thing. Um, and as parents, I often tell parents, let's also recognize the positive things that our kids are doing, and really shouting those things out. Because we can, I know as parents, we say, well, they should already be doing that. Yes, they should be doing those things and great, but there are things as adults that we should be doing and we don't. So if they wore their masks that day and they washed their hands as soon as they got home, recognize that, shout that out, rather than focusing on some of the things that they're not doing right. Because kids get tired. Kids get tired of being told over and over all the things that they're not doing well. And they need to be reminded of the things that they're really doing great in. Again, being creative about finding things to look forward to, which again can be thinking of a game night or thinking of a TV series that you as a family enjoy, or even a book that you and your family can read together, so things that will help them, provide them an additional light at the end of the tunnel is also important. And there are moments and times where we have to kind of look back, but carefully, and kind of re-examine what is working and what's not. This is really important, which again, Jairi was really mentioning here, which is taking these times, these brain breaks that you will get where you're not on your computer, you're not on your phone, to allow yourself just a moment to be disconnected. If there's anything that I've learned during this pandemic is that I have become too available to people sometimes, because my phone is always with me. So I've now purposely had to put my phone in my bedroom for like 20 minutes where it's far away from me and I'm just either with my wife, my dog, or whoever in that moment, and nothing else matters. And taking time to talking as a family, checking in with each other, seeing how things are going, is also really important. And one of the things, and the reason that we're talking about all these things is, although, many times people will say to Jairi and I, okay, I know this is just like what you're supposed to say, or that research tells you that this is what's, how we cope, and that's supposed to be beneficial, but there are actual reasons why this is beneficial to us as individuals, and that has to do more with the chemicals in our brains. So we release many chemicals that help us feel happy, that help us cope with situations. And those, the acronym that you can always remember is DOSE, which is dopamine, oxytocin, serotonin, and endorphins. So what the dopamine is, those get triggered, that chemical gets triggered when we're doing things that we enjoy, learning about things, what motivates us. So if for me, one of the things that I enjoy more than anything else, and my wife will attest to this, is singing. So there are moments and times where I'm just having a karaoke session by myself.
Let's hear it.
Yeah. Yeah. That's my moment, not everybody else's moment. I don't want to drop their dopamine, Jairi. But
okay.
Those are the things that really do help, and the oxytocins, which Jairi was really talking about, which is building those relationships with other people. I think that what you said about writing letters, because I thought about it for that moment. I was like, oh my God, like
people used to do that.
Yeah, and I would be grateful to just be able to unexpectedly get a letter.
Yes.
Like, oh, like
yes.
great, somebody actually took the time to write to me.
Right.
Serotonins, the way that we get those is through, feeling significant. So telling our kids
when you get that letter in the mail.
Exactly. Or even when we get that praise about something that we did really well, those are our serotonin levels going up. So when you're, as an adult, when your supervisor says something positive about the work that you did that made you feel really important in that moment, that's what's going on. And The reason Jairi and I have talked about exercising to a very lengthy extent is because we know that exercise releases the chemical.
All these good things.
Yeah. So those are all these four things really help us. And Jairi will talk a little bit more about how we can continue releasing these type of chemicals in our own brains.
Yes. So here's that buzzword that we've been hearing about throughout the entire pandemic: self-care, right? And what many of us think right away when we hear the term self-care is like, oh, great, now I have to spend a lot of money. Like now, I have to go on these dates that are expensive, or I have to, buy all these things. And not necessarily, right? So first thing I want to point out is that there are several types of self-care. Right. We have physical, emotional, social, spiritual self-care, personal, the space, right? Financial self-care, and work. And so when you think of it, hopefully, now you can broaden your perspective of self-care and ways that you can actually engage in it. So let's look at physical, for example, right? That is what we've been speaking of the whole time, right? Sleep, stretching, walking, exercising, making sure that your nutrition is in check, and maybe doing some yoga, right? Some emotional self-care is stress management. Like Jose said earlier, acknowledging that, I'm overwhelmed. This is too much for me today. And then coming up with some ways to express that, maybe through therapy. That could be the physical therapy. That could also be talking to a therapist, right? And some counseling, journaling to release some of those negative thoughts or emotions, and showing yourself the self-compassion that we spoke of earlier. The next is boundaries, right? Again, we spoke so much about, like, basically we've taken our office and we've placed it right in the middle of our living rooms, right? So now that we had to do that, how can we still have a functional house and complete our task at work? And that starts by building these boundaries, a support system, someone like Jose and myself to bounce off these headaches of the day, right? Like today sucked, it was this, it was annoying, the meetings were terrible, right? So you need that support system. Other people that are experiencing the same that can also tell you that there is a light at the end of the tunnel, some positive feedback. Social media every now and again is okay. And some communication with friends, making sure that you are staying connected, although we are social distancing. Spiritual, just some time alone, maybe doing some meditation. If you believe in a higher power, some praying, and a nice, identify a nice sacred space that you can go to. And also identify a time where you can tell your children, mommy, daddy, we need a time out right now. Like, just give me 15, 20 minutes. Trust me, you're doing yourself a favor. Let me give myself this time out for about 15 minutes, and be okay with checking out for a little while to take care of what's going on internally. So personal, like Jose was saying, do some hobbies, maybe do some baking, find things to do around the house. Actually, when you were speaking earlier, Jose, I thought about when my daughter decided to create a movie theater. So like she made tickets for everyone. We put popcorn, put in little containers, right? So it was movie night. So being creative while safe. Identify some goals, either personal, family goals, and be authentic, right, to yourself. Some space, we talked about healthy space, a healthy environment, some stability, meaning some structure in your schedule, and a clean space. I know that things have just become bombarded, but I realize that when my space around me, my physical space, is clean, that it aligns with my internal space, and I feel more at peace and like organized. Finances. This pandemic has allowed many to save because you haven't had many places to spend, but it's also allowed us to value the dollar, right? And so budgeting a little bit more, money management, and again, there's that word boundaries. And the last one is work, right? Time management. So I'm going to dedicate this amount of hours to work. I'm only going to work until this time. And after that, it's going to be family time, right? And giving yourself a break when you feel overwhelmed. Again, it's okay to say, I need time out. This was a lot for me. It'll be great to be able to cut off previous stressors when you go on to work, but that's not always possible. And sometimes things blend. So to be able to say, you know what, I'm still, stressed about what happened yesterday. And now this added stress from work or the children is too much. And I need to take a break, maybe take a break to do some meditating or to do some stretching, some deep breathing, right? To recenter yourself so that you can start again. So I want tonight's goal to be to just look at self-care in a bigger realm, think about the ways that you can participate in it, all in the effort to make sure that you are staying rebooted, that you're re-energized, and that you are looking forward to that light at the end of the tunnel.
Thank you, Jay. That really does kind of hit home to me more than anything else, because I think it's important to understand that sometimes self-care may be able to be accomplished in other ways that I hadn't thought about. Also kind of have to recognize that sometimes in order for me to exercise self-care, one of the things that I have to kind of own is I also need to own asking for help. And
delegating things to others.
Delegating things to others, or even saying sometimes, you know what, I can't take this on, or able to admit saying, you know what, I'm not in a place to do that. And but I need to ask somebody else who is in that space. And that's okay. And I understand the difficulties that people have with being able to ask for help. But I also know how it feels when I'm able to help, and what a wonderful gift that is for me to be able to help someone. So if you're ever in doubt about asking for help, think about it in this way. People have given you the opportunity to help them and have allowed you to experience that joy in helping them. What a gift it would be to be able to give that back to someone else when you're in need of help.
I really love that perspective.
And coming to an end, our goal here for tonight's webinar was really to help parents understand that we want our families in Teaneck to really burn bright, not burn out. So for us, more than anything else, is understanding that when possible, and understanding that things will always change and are fluctuating, it's okay that if you're burning the candlesticks at both ends, but it's important to recognize it when it's happening, so you can stop it, and you're actually burning from the place you want to burn from, and not being completely depleted. Jerry, do you have any last words before we get to the Q&A?
That's it. I'm excited for the Q&A. Again, we wanted to acknowledge that, there is some stress, that there is a possibility of burnout, and want to give you some tools and some little nuggets on how to kind of press pause and re-energize. So we hope that we did that for you tonight.
Well, I'm back because, I always get excited. I'm taking my notes and all the nuggets. Again, amazing, which is one of the many reasons that I so appreciate working with you guys through the second year of the mental health initiative. And I realized when we started, I didn't give all of the descriptors because I wanted to make sure that we get through, the meat and potatoes and the important part. Not that the funding isn't important, but we are funded. The mental health initiative is funded through the School Climate Transformation Grant. This is the second year of the 5-year grant that was awarded to the district. So that's why we have been honored to have the mental health initiative. And I've been blessed to work with both Jose and Jairi for the past year, and excited to continue the work definitely for the remainder of this year and into the future. But some of the nuggets, as you said, Jairi, that I took away, and I would love to hear you talk a little bit more about reestablishing boundaries, right? Because, as we all know, our work-life balance is, I don't know where the balance or boundaries are. So what would you each say could be one way to reestablish boundaries, since most of us are working from home? If you could just give 1 or 2 tips on that.
I would start by saying planning. I've actually had many of my clients, both students and adults, to actually pull out a calendar for me with and plan hourly, not only for things that they have to do, but also build in time for nothing. It literally needs to say self-care. And that would be definitely my first tip to give, is that to actually plan what your day looks like, work life, family life, and self-care needs to all be elements there.
Awesome. Thank you for that. Jose, what about you?
I think that the one piece for me is actually checking in with ourselves physically in terms of our health. I know the pandemic has unfortunately stopped us from going to see our primary care physicians and getting those annual checkups. But those annual checkups are so vital because they identify if there are any issues that need to be taken care of before they get worse. And I know one of the things because of where I work in the hospital, what we've seen is the decline of parents taking their children for their annual wellness checks, for their vaccinations, all these things which were built there to be able to support children in identifying any physical or mental health issues. So I would always say, in terms of self-care, take care of your physical needs first, and then we can worry about everything else.
That's absolutely right. And I mean, I know we talked a little bit about it in one of the other sessions, just about the access also to mental health care because we're virtual. So can you guys give us some tips? Not, again, as you know, Jose said, make sure physically we're well, but now if we're in a place where we're physically well, what are some ways that our community can access mental health care?
So I like to, I mean, a lot of times people want to use their health insurance, right? You're already paying for it, so you want to use it. And so what I would suggest is that they contact the customer service on their health insurance, ask them to email them a list of therapists. That cuts a lot of the work down when you keep calling people. I mean, you're already acknowledging that you are stressed, you're overwhelmed, you're reaching out for help. The last thing that you want to do is keep getting rejected. So it is very important to call your insurance directly, ask them to email you a list of therapists, and start from there.
Awesome. Jose?
Kind of add to that is many insurance companies already have care managers. So they will actually do the work for you if you let them know what your criteria is, and will actually contact therapists on your behalf. Again, I think that's really helpful to have. And the reason it's there is to reduce costs, to ensure that you're using in-network providers, but take advantage of that, because if you don't have time as a parent to do that, let somebody else take that on, and that's definitely okay. So again, knowing what you can delegate it to other people is important. And the other piece that I would share is choose your battles. You know, so know when you want to fight a battle with your kid, and when you know what, this isn't the one today. It's okay. I'm going to let this one go and keep it moving.
Understood. Like having pancakes for dinner with whipped cream.
Why not?
Why not? Why not? Thank you for that. There was a question about self-care. What is the most basic self-care tip for kids? And I'm gonna break it down a little bit more. An example for a different grade level. So again, with the mental health initiative, you both have been working and doing a fabulous job, by the way, to support our families in grades K-8 in Teaneck Public Schools. So if each of you could maybe share like one tip for our K-5 students on, or even K-4 rather, like what they could do for like a kid version of self-care. Because if you ask a kid to do self-care, they may not necessarily, know how to generate those responses. And then maybe a self-care tip for middle school and then the high schoolers. So I'm going to ask Jose, share a little bit for elementary school?
Elementary school, the most basic thing that we can do for self-care is a routine bedtime. And the reason for that is oftentimes what we have found out, Jerry and I, when we're doing our initial assessments with children, is a lot of the behaviors, their misbehaviors, not focusing in class, being distracted, goes back to sleep. And when you ask kids, what time are you going to bed? They'll say like 11 or 12 o'clock at night. And then
or when I fall asleep.
Or 7. So the most basic thing is getting your children back on a routine bedtime. And I would always say to parents, like, teach your kids that their bed is for sleep. They should not be eating in their beds, not be playing video games in their bed. They should not be doing homework in their beds. Their bed is to sleep or nap, and that's all. So, because that builds that association. When you go into bed, you will knock out very quickly instead of thinking, oh, like this is my time to do work, which is the trap that we fall into as we get older.
Mhm.
Take a note for self, note to self, bed is for sleep, not working on plans. Thank you for that. Jairi, give us a middle school tip
Middle
for
school.
self-care.
So my focus would totally be one that releases all of those happy chemicals that we talked about, right?
Mhm.
So identifying with a child, what is it that makes you happy, right?
Mhm.
What makes you feel most fulfilled, and to have a list of things. And this is what I actually create when I work with the students in TNEC and in my practice is, let's list some things that create happiness for you, and of course trying to shape that into the pandemic lifestyle. So if it was movies, let's watch movies at home. If it was reading a book, okay, let's see if mom or dad will order you books from Amazon. So let's work on and build on the thing that makes you feel happy, because happiness is a great distraction from what's happening right now.
Awesome. So then high school, and either one want to share a little high school tip.
So high school is definitely, because it means so much to them, their peer, what peers think of them, right? Just staying connected with friends, keeping those relationships. They have, as Jose was speaking of, a lot of milestones to look forward to, a lot of changes that are happening. So they need to be able to relate to someone who's experiencing it at the same time. I think they better receive that information from friends. So staying connected is what I would suggest for high school and self-care.
Yeah.
Awesome.
And I think the only other piece that I would add to that is helping your teenagers know what they have control in and allowing them to make decisions, because a lot of decisions are made by adults. So
Right.
whenever they can make a decision, let them make the decision.
Awesome. And I mean, I think that would go for that entire span, right? So whenever from our K to 12, when they can make a decision, if it's pancakes for dinner, I keep saying that because that's the highlight in the house. Like, can we have pancakes for dinner? It's food. Go ahead
It's
and eat it.
food.
If it's good for breakfast, you can have it for dinner. But I think all those tips, or as you say, Jairi, nuggets are awesome. So time flies when you're having fun and learning a lot. So the hour is up.
Sheesh.
Right. So first I want to say, as always, thank you for our TNEC family and friends that are watching. Jose and Jairi put the PowerPoint together. They have been dropping nuggets for our students and families in grades K to 8 this is their second year now. And I'm so excited and thankful that you guys are on this journey with me and with us to support our students in the district. Before I do my run the credits, I do want to ask each of you to just kind of share, briefly share like a closing thought for our families for today.
Okay. So the closing remark that I would want you all to remember is that every time we say yes to something that we do not want to do, every time that you are taking on that additional task, every time that you are not checking in with yourself and being authentic, you are saying no to yourself. So saying yes to unwanted things and activities is saying no and rejecting yourself.
Thank you for that. Jose?
I think my closing remarks would be more along the lines of what Jairi just said, which is understanding your limits. You can't be everything for everyone, and that is okay. You are enough, is what I will always remind you as parents.
Jose, are you talking specifically to me? Thank you. So that being the case, thank you guys again so much. And again, our TNEC friends and family that have joined with us, whether you're live, I see a couple of family friends that are here with us, or if you're going to watch it later, because we will be putting this on our TNEC School THS Counselors YouTube channel. And of course, here goes my credits. I want to thank Dr. Irving, our superintendent, my boss, for supporting me in this endeavor and, pushing me to be my best, but reminding me that what I'm doing is enough. And of course, our entire Board of Education and everyone who has allowed both Jairi and Jose to work with their children. So thank you guys so much for having the confidence in them and in this program to allow us to support you and your family. So that being the case, I do hope all is well and continues to be well. We have our next one, which is coming up in April. I don't remember the date specifically, but we will be doing another one in April and in May. So be on the lookout. You can follow TNEC School Counseling both on Facebook and Instagram. If you are a TNEC High School student or parent or guardian, all this information is usually sent out in my monthly newsletters from THS Connections. So we are trying to connect we'll continue to connect with everyone. So that is it. Thank you so much, everyone. Take care. Good night and be well.
Good night.
Right.